In this section, Dr. D'Antonio and the animation team will try to describe the difference between a physical inability to close the velum and the compensatory articulations that sometimes accompany this problem. The physical problems can be fixed by the surgeon, but only the speech pathologist can fix the compensatory articulations. We'll start this video by looking at the nasal endoscopy of a normal speaker.
Pa 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 pa.
Good. Once more, just like that.
Pa 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 pa.
Count from 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good.
Here is a nasal endoscopy of the same thing. You can see the velar lift during speech. In this nasal endoscopy, we see a child who is physically incapable of closing his velum due to scarring from his cleft palate. He has good lateral wall movement but can never close in the center. This is a surgical problem.
Say puppy.
Puppy.
Say puffy.
Puppy.
Say pamper.
Apple.
Say bye Bobby a puppy.
Bobby and puppy.
Say sissy sees the sun. Okay, say pop 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 pop.
In this next section, a pharyngeal flap has been done on a patient like this, which has corrected his problem.
Pa 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 pa.
Pa 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 pa.
Puppy.
Puppy.
Good. Puffy.
Puffy. Pamper.
Really make that second P. Pamper.
Pamper.
Good. Do it again.
Pamper.
Bye Bobby a puppy.
Bye Bobby a puppy.
Sissy sees the sun.
Sissy sees the sun.
Pa 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 pa.
Pa 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 pa.
Perfect. Really make all.
In this next child, a surgical correction has been performed. As you will see, he is capable of speaking perfectly normally, but he continues to have some problems with his S. This phoneme-specific velopharyngeal incompetence is a problem addressed by the speech therapist, not the surgeon.
Peep.
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 Bib.
Bib.
9.
9.
Tote.
Tote.
Dad.
Dad.
Coke.
Coke.
Gag.
Gag.
Fife.
Fife.
View.
View.
Hive.
Hive.
Sis.
Sis.
Pop 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 pop.
Pa 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 pa.
Puppy.
Puppy.
Puffy.
Puffy.
Muffin.
Muffin.
Pamper.
Pamper.
Bye Bobby a puppy.
Bye Bobby a puppy.
Sissy sees the sun.
Sissy sees the sun.
In this next section, Dr. D'Antonio demonstrates using a sound the child can make, in this case a T, and migrates it into an S. This speech therapy has been successful in teaching the child he can produce this sound. This is a speech therapy correction and not a surgical one.
Thank you. Can you say pa pa pa?
Pa pa pa.
Puppy.
Puppy.
Puffy.
Puffy.
Pamper.
Pamper.
Bye Bobby a puppy.
Bye Bobby a puppy.
Sissy sees the sun.
Sissy sees the sun.
Okay, make that T. Okay.
Now with the aid of the animators, we will show how an S or SH sound should be made. The palate is closed, air pressure is built up in the mouth, and the air is dragged across a friction point in the front of the mouth. The child in the preceding video exhibited a common compensatory articulation for S called a nasal fricative. The front of the mouth is closed, a nasal grimace is done to close the front of the nose, and then air is allowed to escape through the front of the nose instead. Another common learned compensatory articulation for S is the pharyngeal fricative. The tongue is placed at the back of the throat and the air is dragged across the friction point low in the throat. By far the most common compensatory articulation is the glottal stop. This is illustrated first by the normal production of the K sound. In this case, the palate is closed, the tongue is brought to the roof of the mouth, air pressure is built up at the tongue, and the tongue is suddenly dropped, producing the sound. In the glottal stop sound, air pressure is built up at the vocal cord level and is suddenly released, producing the characteristic glottal stop. This glottal stop compensation may be found in conjunction with articulating a number of other plosives. In this case, the P sound will be illustrated first normally and then as a glottal stop. Pa, 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 pa. Pum, 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 pum. It should be stressed that compensatory articulations are the behaviors learned by an intelligent person trying to make up for a velum that does not work. Even if subsequently the velum is made to work, these compensatory articulations may persist. These must be fixed by the speech therapist and not the surgeon. You cannot operate on a habit. One of the first things to consider in correction of velopharyngeal incompetence is the idea of palate re-repair. One should question whether the first palate repair was done correctly. If not, the muscle junction may be inadequate, causing a failed palate repair and velopharyngeal incompetence. In the normal, we can see the tensor veli palatini tendon rounding the hamulus and forming an aponeurosis with the other side. The levator muscle is further posterior. As this levator muscle contracts, it pulls the soft palate up and back to close off the nose during speech. In the cleft patient, the levator palati muscle shares a common periosteal insertion with the tensor veli palatini aponeurosis onto the posterior edge of the hard palate. Because of this common attachment, simply detaching the periosteum from the posterior end of the bone is insufficient to allow the levator muscle to retroposition normally. For this reason, it is necessary to cut the tensor veli palatini tendon just medial to the hamulus to allow the levator muscle to be retracted back into normal position. This is not usually done by most cleft palate repairs. This is the fundamental on which all palate re-repairs are based. Dr. Nordoff prefers to perform the furlow-Z-plasty as his primary palate re-repair method. That will not be described in this section, but is given in the primary cleft palate repair section. This is a case of Brian Summerlad's. The child had a palate repair done at another institution with resulting velopharyngeal incompetence. Dr. Summerlad is about to perform a palate re-repair. We will first look at the child's video fluoroscopy and observe that he has velopharyngeal incompetence despite a previous palate repair.
Pa, pa, pa.
Oh, pa,
Put your hand
pa,
down.
pa, pa,
Ba, ba, ba.
pa, pa, pa,
Ta, ta, ta.
ta, ta, ta,
Da, da, da.
da, da, da,
Ka, ka, ka.
ka, ka, ka,